Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Delegates from the Global Alliance for Vaccines and Immunizations, Gavi, inspect cold storage facilities for vaccines in Abuja. The House of Representatives asked the National Primary Healthcare Development Agency to align its data with Port Health Services numbers. And America cautiously revises restrictions as current COVID-19 wave wanes. The World Health Organization, WHO, says a hub has been established in South Korea to train low- and middle-income countries to produce their own COVID-19 vaccines. Dr. Tedros Ghebreyesus, the Director General, at a news briefing said the agency is expanding the COVID-19 vaccine project to 5 nations: Bangladesh, Indonesia, Pakistan, Serbia, and Vietnam. WHO had selected Nigeria, Egypt, Kenya, Senegal, South Africa, and Tunisia to receive technology that is needed to produce the mRNA messenger ribonucleic acid vaccines. Well, according to him, the South Korean facility was already providing training to companies in the country and will now be able to accept international trainees. The new facility will share mRNA technology being developed by WHO and partners in South Africa. Meanwhile, more cases were reported across Nigeria, logged in 4 states and the Federal Capital Territory. Here's more on the pandemic update.
42 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 4 states and the FCT and indicate a rise from the figures reported earlier. Lagos had the most cases with 25 reported infections, followed by the FCT, which had 13 cases. Kaduna came in with 2 cases, while Kano and Oyo had 1 case each. Nigeria now has a cumulative caseload of 254,394. No cases were reported from 8 states: Bauchi, Ekiti, Nasarawa, Sokoto, and others. 15 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 230,861. There were no additional deaths recorded in the last 24 hours, leaving the fatality toll at 3,142. Currently, there are over 20,000 active cases in Nigeria, while more than 4.3 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 active infections, followed by Benue and Kwara states. More than 17 million Nigerians of eligible age, representing 15.6% of the target population, have received 1 dose of the COVID-19 vaccine, while more than 7.8 million of the population, representing 7.1%, are fully vaccinated. In Africa, over 11 million persons have tested positive, while over 247,000 deaths have been recorded across countries on the continent. Globally, the total number of confirmed cases has surpassed 430 million, while deaths are now beyond 5.9 million.
The House of Representatives is urging the National Primary Healthcare Development Agency to work towards creating the required synergy between its vaccine operations and the Port Health Services to ensure online real-time access to vaccination records of travellers from the database. Well, this follows a motion on the need to investigate the COVID-19 vaccine database of travellers by Representative Obinna Chidoka. The House has also mandated its Committee on Healthcare Services to investigate the activities of the COVID-19 vaccination unit, especially as it relates to the records of vaccinations, to ensure that such records are duly kept in the approved database. The committee is also to investigate the issuance of fake COVID-19 vaccination cards and the funds spent on maintaining a national database of COVID-19 vaccination, and the inability of key government agencies to have real-time access to the COVID-19 vaccination database.
Starts now. Records of COVID vaccination administered by the various units nationwide are expected to be uploaded in a database which can be accessed by the COVID-19 units at various entry and exit points in Nigeria, particularly at the international airport. Concerned that the port health services at the Nnamdi Azikiwe International Airport, Abuja, which has the primary responsibility of checking the vaccine and health status of travelers, do not have efficient synergy with the National Primary Health Care Development Agency that takes care of the COVID-19 vaccine mandate, thereby creating embarrassing bottlenecks for travelers on a daily basis. Also concerned that the National Primary Health Development Agency, with all the resources at its disposal, cannot maintain effective and efficient handling of its database so that its website collapses frequently, rendering it most inaccessible.
Well, business owners, poor and vulnerable households of Taraba State affected by the impact of the COVID-19 lockdown may soon heave a sigh of relief as the state governor gives over 100 million naira to alleviate their challenges. This forms part of the preparatory arrangement between the state government and the World Bank to cushion the effect of hardship faced by victims, as well as give them a sense of belonging. Speaking to Channels Television, chairman of the steering committee of Cares in Taraba State disclosed that millions of households affected by the pandemic have been captured and are awaiting disbursement, while urging residents to disregard claims by individuals that the Cares was political. Chairman of the steering committee stressed that the program is strictly to assist humanity.
We have been doing a lot within our reach in making sure that the program have a success in the area of taking off. And perhaps His Excellency did not stop at inaugurating the steering committee headed by myself. He went as far as making available fund over 100 million for all the delivery unit to be able to do the needful in the area of preparatory towards the proper taking off of the COVID-19, of the NG cares here in the States. Yes, the NG cares in Taraba State, what we call TR cares, has come on board. And at the level of the World Bank assessment of our readiness in the takeoff of the program, we scored 83%. Perhaps the delivery unit, which consists of FADAMA, CSDP, and the cash transfer, which is at the Ministry of Cooperative and Poverty Alleviation, and the small and medium scale enterprises, which is under the Ministry of Commerce and Industry. And as I'm talking to you now, all the delivery units have been doing very, very well, owing to the fact that the little fund provided by the state government has also gone a long way to make the stage very clear for the proper takeoff.
In January 2022, at least 2 studies from different research institutions show that cannabidiol, CBD, and 2 other related chemical compounds found in hemp may hold promise in the prevention and/or treatment of COVID-19. The 2 studies published in January 2022 found an association between the ingestion of certain non-psychoactive cannabinoids and negative COVID-19 tests, in one case indicating that the hemp compounds may prevent SARS-CoV-2 infection in human cells. Well, in the other study, CBD was shown to inhibit the replication of the virus in infected cells. However, these studies were done in human cells and in mice, and not humans. Joining us to talk more about this, Dr. Alex McGregor, Professor of Pharmaceutics and Clinical Pharmacology. He's visiting from Canada. He joins us here in Lagos via Zoom. Thank you for joining us on the program.
Thank you for having me.
Professor, just before we go to that study, I mean, I know you just returned from Canada. I would like to get your reaction on the actions that began there and that we've seen spread to other countries, the truckers and their position on vaccines.
Yes, well, as you know, Canada is one of the most liberal and freest country in the world. The truckers are protesting against excessive restrictions coming from the pandemic, COVID restrictions. Understandably so, because it's been quite a while since COVID has been a pandemic, and naturally people get frustrated and they're protesting against the restrictions that the government put in place. However, the governments have relaxed some of those restrictions now. It appears things are getting back to normality. Some of the blockades have been opened now, and the governments have actually revoked the Emergency Act that they were going to impose to deal with the blockades.
So I guess there's still some confidence in the government to curb the spread of COVID. Let's now talk about this study. Can cannabis prevent COVID-19 infection?
Well, there's potential that it can actually do that, specifically CBD, cannabidiol. It has been tested in vitro, and it has been shown that even CBDA, that is the acid form of CBD, is actually more effective in actually sensitizing the cells and preventing the virus from either entering the cells or actually preventing the virus from replicating itself after it enters the cells. Quite interestingly, CBDA, which is the acid form, is what you consume orally, and it's often it becomes CBD when you actually decarboxylate it by burning. For instance, if you acquire it through the plant, you might have to burn it if people are smoking it. But these is medicinal cannabis that have been tested, highly purified cannabis, about 98% pure, that contain CBD. So the studies are quite promising. However, we have to be cautiously optimistic because clinical trials have not really confirmed these studies as yet.
So in terms of how it will best work, break down the CBD, CBDA for us. In terms of something orally ingested, like a pill, and this we're talking, of course, the prospects from something that is smoked.
Correct. So the CBD, as it were, it's actually non-psychoactive component from the cannabis sativa plant. So, it doesn't, what I mean by that, for a layperson, it's the component that doesn't make you high. The THC is what makes you high. Now, to get the plant itself does not express CBD and THC per se. It expresses the acid forms, the CBDA and THCA. It's only after you actually burn it or you decarboxylate it, but with heat, that it converts into THC and CBD. So essentially, in the native plant, you have this active component that is in acid form that happen to have a medicinal property that if consumed orally as opposed to smoking or burning it would actually have a significant beneficial effect as far as COVID-19 and other viral infection is concerned.
Well, we can't wait to see what the future holds for natural products, especially to tackling COVID. We'd like to thank you, Professor Alex Olusegun-McGregor, Professor of Pharmaceutics, Clinical Pharmacology. Thank you for joining us on the program.
Thank you very much, Fabio. Thank you.
A delegation of Gavi Alliance is on an inspection visit to the National Strategic Cold Store in Abuja. The inspection is part of the Vaccines Accountability Framework aimed at ensuring equitable distribution and usage of all vaccines, including COVID-19 vaccines donated to partners. Well, the visit to the cold store in Abuja is to address and evaluate the storage conditions for vaccines and also their level of use. The delegation is also expected to visit some primary healthcare centers and evaluate them if there is value for healthcare investments over the years in the country.
Officials of the Global Alliance for Vaccines and Immunization and the National Primary Healthcare Development Agency inspect the vaccines cold store in Abuja.
So last time it was UPS that did the distribution.
The inspection is part of Gavi's transparency and accountability framework, which aims to benchmark value for investment into the health sector. Gavi is a global health partnership of public and private sector organizations dedicated to immunization. And this explains why the delegation is interested in the storage and usage of all the vaccines donated to Nigeria in recent times.
Today marks the second day of the visit of the Gavi high-level mission to Nigeria, which really is targeted at looking at the accountability framework that was developed since 2018 between Gavi and Nigeria. So a sort of indicators around how we're doing in terms of making sure that we have provided adequate resources to procure vaccines for our kids.
We are here to support, of course, the government's ambition to reach their targets, but also the most important, it is that strengthening the health system so that the routine immunization is not left behind.
The team took a tour of the cold store, opening the freezers at some point for proper evaluation. And at the end of the tour, the head of the delegation has this to say.
If we're to compare with previous years, Nigeria used to receive 4 shipments of vaccines per year, which were planned, and now we're talking about 200 shipments in a year. And we also are seeing firsthand the need for further expansion of the overall cold chain capacity, not just at the nation level, but also looking at the regional level, having potentially hubs that will really unlock and fast-track the distribution of vaccines to where they are needed and much faster.
Gavi is a major leader of COVAX, which is the body that helps facilitate equitable access to COVID-19 vaccines in developing countries. Gavi has committed over $1 billion to fund immunization in its 10-year transition plan in Nigeria, covering 2018 to 2028.
We'll talk some more about the Vaccines Accountability Framework. Professor Lekan Ayo-Yusuf, Professor and Head, School of Health Systems, Public Health, University of Pretoria, joins us on the program. Thank you for joining us on the program.
Thank you for having me.
What's your take on the Vaccines Accountability Framework, which is aimed at ensuring equitable distribution and usage of all vaccines, including COVID-19 especially? Do you think that it has met the objectives it set out in the first place?
Well, I mean, there are a couple of issues that one has to look at. There's some trade-offs that you have to consider as well. Understanding that Gavi is not just about the COVID vaccine, but about vaccination and immunization in general. Over 17 infectious diseases have vaccines that Gavi has to deal with. But of course, given the scale of the COVID-19, and imagine there's already 5 times the amount of vaccines produced than what the world was used to. The accountability framework definitely has come at a time when, if you do not manage this properly, it's either that you're going to forget the COVID vaccination may crowd out the childhood illnesses and all the other vaccines. So it's important that while COVID vaccines are being distributed, all other vaccines are not neglected or they don't go to waste. So there's also the concept of availability versus accessibility. So they may be available, but if they don't get well distributed or equitably distributed and they get to expire, then you have a situation of wastage as well. So accountability is most important when you scale up capacity like has never been done, as we've seen with COVID-19.
Yes, and still on COVID, also talking about the speed of the COVID vaccine, some would say that perhaps the shortcoming for Gavi is the lack of equitable distribution, seeing as some parts of the world, can't get access to enough vaccines.
That's very true. The whole idea around equitable distribution does not only depend on commitment from Gavi. It's a commitment from private industry, the pharmaceuticals that produce this, commitment from government and from civil society. Unfortunately, we've seen a situation where many governments in rich world have essentially paid up vaccines. I mean, just imagine that currently we've got over 75% of population in the global north already vaccinated with at least fully vaccinated, 2 or 3 doses, but only 10% in the lower middle income countries are still vaccinated. So for the best effort of Gavi, equitable distribution is not yet a reality. Because it's dependent on this support of government, the skill at which the capacity can be transferred to low and middle income countries will take about 2 years. And this is why we're only beginning to see the transfer of technology and manufacturing coming now to these countries in low and middle income countries. So unfortunately, on the one hand, they've done remarkably well in moving capacity for vaccine production beyond COVID, which is going to help with other vaccines to bring that to low and middle income countries. But unfortunately, the speed of production and distribution has not been able to get equitable distribution of vaccine yet into the world.
But now it looks like the world is somewhat dropping almost all restrictions, maybe in more parts than others, and learning to live with COVID-19 as a new normal. What would you say Gavi should now focus on moving forward? And this is also as regards the COVID-19 pandemic.
I mean, the primary mandate of Gavi is obviously around making vaccines available and equitably distributed around the world for those 17 infectious diseases. And so it's important that Gavi, while it's scaling up the capacity, for example, for mRNA technology, which we now know that it may not only be necessary for COVID-19, but for HIV, there's a potential for vaccine against malaria, diabetes. So Gavi should be focusing on getting this cooperation of governments, civil society, and private industry to get this technology to the developing countries. And of course, working with governments around the world to continue to increase investment in vaccination and immunization.
Thank you so much, Professor Leko Ayo-Yusuf, Professor and Head, School of Health Systems, Public Health, University of Pretoria, joining us there. Thank you for joining us on the program. And modelled after recent trucker protests in Canada, truck drivers in the U.S. are planning on setting off on a massive cross-country drive towards Washington, D.C. to protest against coronavirus restrictions. Organisers of the People's Convoy say they want to jumpstart the economy and reopen the country. The 11-day trek that is estimated to be 4,000 kilometres long will approach the Beltway, which encircles the U.S. Capitol on March 5th, but will not be going into D.C. proper, and this is according to a statement. In the meantime, more than 93.2 million people have received the COVID-19 booster dose. The U.S. CDC is reporting that the Omicron cases are dropping, but says that it remains vigilant. Our correspondent Maria Bird has more.
The U.S. is now preparing for the next wave of the pandemic as the Omicron wave begins to slow down.
Omicron cases are declining, and we are all cautiously optimistic about the trajectory we are on. Things are moving in the right direction, but we want to remain vigilant to do all we can so that this trajectory continues. As we see the Omicron wave continue to wane, we know that you have many questions regarding what prevention strategies are really necessary for this moment, especially as people are so eager to remove them. We are assessing the most important factors based on where where we are in the pandemic and will soon put guidance in place that is relevant and encourages prevention measures when they are most needed to protect public health and our hospitals. We want to give people a break from things like mask wearing when these metrics are better, and then have the ability to reach for them again should things worsen. If and when we update our guidance, we will communicate that clearly, and it will be based on the data and the science.
While the CDC develops revised COVID-19 protocols, many Americans are ready to move on.
Or you can visit our website for more updates, a better understanding of the pandemic, plus other stories at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker.